we have overgrown teeth on the upper jaws on our elephant Cora, and this has been going on for a while, and it has caused a wound on the roof of her mouth. So we needed to make sure we take the overgrown tooth. Usually the tooth will fall off on its own, and so we had to remove that. So I invited Dr. Doug Winter, who is a veterinary dentist specializing in zoo and wildlife animals, to come to do this procedure. And so we did this under a standing sedation. That means the animal is not completely down. She's standing sedated, meaning she's relaxed, but she is still aware of essentially of what's going on. And we managed to accomplish that successfully this morning with Dr. Winter's help. And you can continue with what you actually did.
Yeah, so we took a grinder with what we call a ceramic blade, and this protrusion off of those molars is what was causing the trauma to her roof of her mouth. And by removing this, then that area will heal and it will be more comfortable. This should have broke off, and it didn't. And so that's what we helped the elephant with.
We noticed that this was going on with her maybe a month ago, and had actually, I mean, we do a lot with animal training here. I'm amazed at what our staff accomplishes. Cora was actually conditioned to let our staff work inside her mouth, fully awake. But we were only able to remove small pieces of that tooth at a time. And then when it started rubbing on the roof of her mouth, that's when we really decided something's got to be done. Because the worst case scenario is there was a sore on the roof of her mouth. What if that leads to a bacterial infection? What if suddenly she stops eating? Then things get much worse. There's plenty of risks involved with anesthetizing geriatric animal. But it was at that point that if we didn't solve this problem, other risks were going to get worse.